Hi, my name is Makeda Robinson. I'm an infectious diseases specialist and postdoctoral fellow at Stanford University. And I have been studying virus-host interactions in the setting of emerging and re-emerging viruses, such as dengue virus, in an effort to better understand and treat these infections. Dengue, named after the stiff movements of the patients it infects due to severe muscle and joint pains, is a mosquito-borne illness that infects up to 400 million people annually. However, many of these millions of people infected with dengue have no idea they've been infected. But those who do develop symptoms have to deal with the uncertainty of not knowing whether or not they'll have a mild flu-like illness, which they'll recover from quickly, or progress to severe shock syndrome, which can ultimately be life-threatening. But what if we could tell these patients whether or not they needed to be monitored in a hospital or could rest at home early in the course of illness, thereby saving patients time and energy and preventing hospitals from reaching capacity? Dengue virus has become a growing threat to public health, in part due to the effects of globalization and climate change. And dengue disproportionately affects children, who are at higher risk of developing severe symptoms that can lead to fluid accumulation. We still are learning about the risk factors for severe dengue. But the best known risk for developing severe symptoms is a second infection with a different dengue serotype or strain, of which there are at least 4. This leads to an immune phenomenon called antibody-dependent enhancement, where our own antibodies made to the initial dengue infection are unable to neutralize the new dengue serotype. Instead, they form immune complexes with the viral particles and facilitate their entry into cells, where the virus can continue to replicate. However, everyone who develops a second dengue infection does not progress to severe disease. So we still don't know the whole story. And this demonstrates the clear need to improve our knowledge of dengue pathogenesis to better understand and predict disease progression. The research question I'm interested in answering is, can we identify predictive signatures or biomarkers in the blood that can distinguish patients at highest risk for progressing to severe dengue? The discovery of a predictive signature has the potential to improve patient outcomes, as well as support clinical decision-making, which can lead to improved resource allocation, which in the setting of large-scale outbreaks is critical to prevent overwhelming hospitals. My research project is focused on studying this globally important virus at a single cell level to pinpoint the timing and magnitude of the immune responses that trigger severe dengue. To do so, I am part of an international collaboration where we have designed and recruited a cohort of over 300 dengue patients in 2 sites in Colombia to evaluate the early immune responses to the virus prior to the progression to severe symptoms. The participants in our cohort include adults and children, which will allow me to evaluate differences between both disease severity and age categories. And we also obtain a blood sample at least 1 month after the acute infection to allow us to monitor the immune dynamics over time. To begin to address these questions, I am applying innovative immune technologies to the study of dengue, which includes the evaluation of single immune cells at the transcript and protein level. This analysis will allow me to quantify immune cell abundance, identify dengue target cells, measure activating and inhibitory marker expression, and monitor these responses in longitudinal samples in a diversity of immune cell populations. This systems approach, coupled with functional studies, will give me the capacity to explore the complex interplay between the viral pathogen and the human host in order to reveal a more complete picture of the preventative and pathogenic elements that drive dengue outcomes. This line of research also has real-world applications with the potential to be translated from the bench to the bedside through several different avenues. For example, the identification of a prognostic signature associated with severe dengue progressors could be used as a tool in the clinical setting to guide triage and treatment decisions for those suffering with dengue infection. This project could also identify a major regulatory immune cell type with the capacity to orchestrate the immune dysregulation associated with severe outcomes, thereby providing insights into the development of novel cell therapies. And lastly, from a big picture perspective, the creation of a research pipeline, starting with patient samples and leading to functional studies, could be extrapolated to other emerging viruses for which we have limited understanding, to rapidly gain knowledge about their pathogenic characteristics, thereby expediting the development of countermeasures aimed at muting their impact on human health.